Hi guys, Zach Williams here. I was going to be taking you through a median nerve tension test, and because we're in lockdown right now, we're just going to be doing a self-median nerve tension test. So it's sort of going to be like in the telehealth sort of setting. So I'm just going to be asking the patient to be standing in a neutral position, horizontally abduct their shoulder, out like so, then keep their elbow bent to start with to prevent any sort of initial onset of pain. I'll get them to supinate their hand all the way so it is flat, preventing any sort of radial deviation as well whilst doing that. Then I'll ask the patient then to straighten their elbow, extend their wrist and extend their fingers. If they have any sort of compromisation to their median nerve, they should feel altered sensation and different types of radiculopathy down their arm. To further increase of where this sort of symptoms are coming from, we can start to differentiate whether it is from the proximal end or the distal end. For proximal end, you can get the patient to then laterally flex their head away from the side their arm is up. This will then stretch the nerve root, presenting symptoms relating to proximal nerve radiculopathy. Also, if still getting symptoms whilst in a neutral position, you get the patient to then flex their fingers and also bring their hand to a neutral position. And if this relieves the symptoms, we're then looking at a proximal sort of issue here. Whilst we're here, we'll also go on to sort of an ulnar nerve tension test. Again, a self-one at home, not in a clinical setting. So you basically just get the patient to put their little finger up against their ear and their whole hand, pretending like they can't hear someone. So you just get the patient to do like so, like that. Then in turn, stretching their ulnar nerve. Again, you can do the same sort of thing, where you then also laterally flex the head away to present if it is proximal symptoms, or also start to flex the wrist and the fingers to determine if there is distal symptoms. While we're here, we may as well also do a bit of radial nerve tension test. So with radial nerve tension test, the patient just has to bring their arm behind them. They then need to supinate their hand whilst behind them, and also flex their hand up like so. This puts strain on the radial nerve. Again, the patient can try and exacerbate symptoms to see if it is a proximal issue by laterally flexing their head away, or also if it's a distal issue by then also putting their hand back in a neutral position. That is how you do a radial, median and ulnar upper limb tension test at home. Thank you.